Hello, our presentation is on the photo articulation test by Adrienne, Estelle, Sarah, and me, Rachel Caroline. So, what is the PAT-3? This is a standardized speech assessment used by SLPs to evaluate a person's articulation skills by picture-based images and to see how the patient pronounces constant sounds and words. This test is given to mainly 3-year-olds to 8-year-olds and 11 months old. And the total cost of the whole kit is $268. And the publisher for this kit is, or for the test, is the Pro Ed. And the authors are Barbara J. Pendergast and Ronald Goldman. And in our next slide is Estelle and Sarah showing how the kit is used, the test kit is used.
I'm going to show you some pictures. Tell me what the pictures are. Okay. What is this? A pie. What is this? Apple. Good job. What is this? A mug. What else could you call this? A cup. Good. What is this? A monkey. Good. This? Hammer. A comb. Good job. A witch. Good. A flower. Great. A hanger. Good job. A book. Good. A baby. Awesome. A bath. Perfect. A dog. Good. A ladder. Good. A bed. Great. Nails. Banana. Can. Perfect. Do you like ice cream? Yes. What would you say if someone gave you ice cream? Thank you. Perfect. What is this? A cat. This? Crackers. Cake. Perfect. Gum. Wagon. Egg. Table. Awesome. Potatoes. Yes. Hat. Fork. Elephant. Perfect. Knife. Good. Hanger. Perfect. Swing. Jars. Good. Angels. Perfect. Orange. Shoe. Yes. Gas station. Perfect. Fish. Yes. Lamp. Balloon. Yes. Bell. Can you say measure? Measure. Good. Can you say beige? Beige. Perfect. What's this? A vacuum. Good. TV. Gloves. Yes. Chair. Yes. Can you say for this one, what's just one called? Glove. Good. Okay, chair, and then what's this? Matches. Good. Sandwich. Perfect. Saw. Pencil. Yes. House. Perfect. What is this one? Spoon. Roller skates. What's this one? Stars. Perfect. Zipper. Yes. Scissors. Keys. Yes. Blocks. Yes. Clock. Perfect. Flag. Which one's bigger, this or that? This. Say bathe. Bathe. Perfect. What's this? A brush. Crayons. Train. Toothbrush. Teeth. Perfect. What's this? A radio. Carrots. Car. Perfect. These three pictures tell a story. Can you look at them and tell me what's happening? The boy let the bird out the cage, and then the bird flew away. Good job. All right, we're done.
Okay. Um, this talks about what the PAT-3 test measures. To the left, you'll see a scoring sheet, a response form that is used to calculate the articulation errors for the child that you're testing. It measures them in a standardized way, and it allows the clinician to have swift and accurate results. This is great and ideal for use in a school setting, as the results provide a comprehensive view of the student's articulation errors. The categories on the scoring sheet are the age, target consonant sounds produced with focus on initial, medial, and the final position. And there's even an area to document where and how the articulators were used, specifically the tongue and lips, and the production of vowels and diphthongs. Now, the scores yielded are four different values for the PAT-3 test: the raw score, the percentile, the age equivalent, and the standard score. The raw score is the total number of sounds that are missed during the test administration by the child, and that would be noted by a minus sign. The percentile is the rank or percentage of distribution that is equal or below a particular score. And the percentile is a great way of communicating where the student falls in comparison to other students. It's a great way to communicate that to parents and teachers. The age equivalent looks at both reading age and articulation age, and it calculates the average normative group score during a 3-month interval. And standard scores provide the clearest indication of the child's articulation ability, and it's based on normal distribution with a mean of 100 and a standard deviation of 15. These scores are converted and into raw scores and then interpreted. Now, the test validity, there's three types of validity in this test, and it's content validity, criterion related validity, and construct validity. With this test, it's all English speaking children is our content validity. Criterion related, they took the PAT-3 test and compared it to the test of language development primary third edition, and that was found to be equivalent in accuracy. And the construct validity is just meaning that the construct of the test itself is valid. It's a valid test for determining articulation. So the key point, researchers have consistently observed that articulation ability measured by this test has a characteristic relationship with age, which means as the child ages, the mean score decreases due to fewer articulation errors. So this test is very accurate and capable of detecting articulation errors quickly, which makes it a great choice for clinicians.
So, as you saw in the video of Estelle and Sarah, Sarah was the examiner slash SLP, which was pointing to each image on the kit and asking Estelle, "What is this?" and keeps going through all the pages. And if the child were to state the wrong name, the examiner would ask, "What else could you call this?" And if the child still states the wrong name, the examiner would ask, "Can you try to say blank?" For example, in the video, Estelle said cup instead of mug, which Sarah was looking for. And the Examiner slash SLP scores the child's answer on the response form using a plus sign for no error or a minus sign for any kind of error. If the child was asked to imitate the name, the examiner would score an I along with a plus or minus sign. For example, the examiner would say, "What is this?" and points to number one in this image to the left. And the child says a pie, the examiner would score a plus for the child answering correctly. And it's very important to remain encouraging to the child as they're trying to do this test.
Okay, our general impressions of the PAT-3 was that it was relatively easy to learn and administer. It's very straightforward and structured, easy to use, very quick. The clinician presents the pictures and the prompts, and the child names them, and then the clinician records those errors. The PAT-3 is a comprehensive assessment. It has a limited context for speech because it primarily tests single words, but it does test all the consonants, vowels, and diphthongs in all of the different positions, initial, medial, and final in the English language. It is also time efficient. It only takes about 15-20 minutes. Child engagement level can vary. It does use real life photographs as opposed to illustrations that can be helpful to engage children, but it is a test that's a little repetitive with that single word elicitation. So it can become uninteresting as you get toward the end. But overall, it's a very good test. The PAT-3 provides norm reference scores, such as a standard score and the percentile ranks, which we talked about, and those are both helpful for diagnosis and tracking the progress of the student.
Overall, the photo articulation test gives the clinician a good, well-rounded idea of the child's ability to accurately produce speech sounds, specifically looking for articulation disorders. It evaluates sounds such as all of the consonant sounds in the initial, medial, and final position, and both vowels and diphthongs in relation to their peers. The ease of use of this test, as well as the simple scoring, makes this test a valuable resource for many SLPs. And that's the end.